When the game gets rough and this life just seems so tough, Mek Wi Talk, my people, Mek Wi Talk. When this town becomes an ugly place, don't let it erase the smile from your face. Mek Wi Talk, people, Mek Wi Talk. Conversation is the key, a guiding light for you and me. Spark a talk and you will see. Conflict solver A to Z. World leaders master the art of self-defense just by talk. So people, Mek Wi Talk. Hey. When the game gets rough and this life just seems so tough, Mek Wi Talk, my people, Mek Wi Talk. When this town becomes an ugly place, don't let it erase the smile from your face. Mek Wi Talk, people, Mek Wi Talk. Conversation is the key, a guiding light for you and me. Spark a talk and you will see. Conflict solver A to Z. World leaders master the art of self-defense just by talk. So people, Mek Wi Talk. Hey.
Good afternoon. Welcome to the Mek Wi Talk program where we're listening and watching from around the world in the Eastern Caribbean. It's the Mek Wi Talk program with yours truly, Jeffrey T. You know, I want you all to know something this morning. As I come on air, yesterday when I came off air, I should say, I had a call came in on my phone. Are you all hearing me clearly? I hope you all are hearing me clearly. And remember to like, share, and subscribe. Like, share, and subscribe. Like, share, and subscribe to the Mek Wi Talk Jeffrey Tavares YouTube channel. Come on, only 30 people over here. And there's a serious topic we're going to speak about this morning. Morning, Miss Jackson. How you doing? Morning, Juliet Jackson. Good morning, everyone. Good morning, or good afternoon, wherever you are. Good night, wherever you are around the world in the Eastern Caribbean. Yesterday, when I came off air, I had a call about an hour after I came off air. I had a telephone call. Normally, I don't answer private numbers when they call my phone. But I answered this one. The person who called me didn't give their name. The person said, Mr. Tavares, we need to talk. I said, talk about what? You can talk to me on the phone. The person said to me that they want me to stop talking about the hotel issue in Negril. And I laughed. The person went as far and said that we can talk and, I can give them my bank account number. I said to the person, I said, neither you nor no political parties, either in Jamaica or the United States or anywhere else, cannot buy me out. I said, I can make something clear to you, whosoever you are. I will continue standing for the Jamaican people. No one can buy this boy out. And I hung up my phone. Something came to my mouth to say, and I say, it's true. Make I be very, very diplomat and be nice. I hung up my phone. I don't know who the person is. Nor do I want to know who the person is. And when I tell you point blank this morning, I make something absolutely clear. That I don't come on here for anyone to believe that they can come and buy me out. Let me make that absolutely clear. Because I'm not a licky and yummy type of person. So all those who are out there who believe that they can come and call my telephone number and believe that they can get what they want and come around and say, yeah, no, you can't get through to me. I won't accommodate or entertain none of your telephone calls. Anyway, let's get to work this morning. It's a beautiful, beautiful Friday morning. Is the day when all of us get a little chip and halfpenny. Some of us. And we must put it to good use. Good afternoon, wherever you are. This morning, as we come on air, we're going to speak about an issue facing an 11-year-old young lady in Jamaica who was diagnosed with scoliosis. Hope I'm pronouncing the name correctly. And a lot of people are going to blame Dr. Christopher Tufton. Well, this morning, I will not blame Christopher Tufton this morning. I will blame the person who is in charge of the Bustamante Hospital. Because in any organization, you must have people who are below you as a manager or an owner. You own. Let me go. You know, make I use an example. I used to work at a hospital in the Cayman Islands. The owner for the hospital is a good friend of mine. It's like a father to me. Dr. Steve Tomlinson. Dr. Tomlinson have people below him. And the people below him have other people below them. Okay? If the air condition not working, the manager for the hospital, who is below Dr. Tomlinson, supposed to go to the maintenance manager. All right? The maintenance manager is supposed to get somebody to fix the air conditioning in operating theater. Now, based on what I am being told and based on the news, that this young lady who is diagnosed with scoliosis, let me put it up on the plot on the thing here. I'll show a picture of her. That's the way her back is. That's her spine. Her spine is out of place, and that's she's diagnosed with scoliosis. All right, it's a very tedious and technical surgery. Now the doctors who is going to perform this surgery has been coming to Jamaica for many years, over 20-something years. And 2 months ago, he was told about the air condition thing and he told him to get it fixed. Now, when he comes down, it was not fixed. You believe that the CEO for the hospital would have taken up their telephone and called a different hospital and say to them, listen to me, the Bustamante Children's Hospital air conditioning unit in one operating theater not working. Can we use your operating theater to do a surgery on a young lady who has scoliosis? The CEO for the hospital didn't do it. He or she didn't pick up the telephone to make the call. As I said before, I'm not taking up for no one. But where the truth lies, the truth lies. Birthday. What on earth is this person? Hold on for me, please. Yes, where the truth lies, the truth lies. The Minister of Health got involved because when it come on to surgery, no minister must get involved in those things. The CEO of the hospital or the chief medical officer must see to it that things go right. The CEO, the CEO of the hospital must make sure that if a surgery can't happen at this hospital, the doctor who is in charge of the hospital or the surgical area liaison with other doctors and say, okay, we have to put this thing over and ask another hospital if we can use the operating theater. Nobody didn't see fit to do it. The minister had to get involved and call University of Western Hospital for the young lady to do the surgery there. It was too late. Because the people who came here to do the surgery for free had to leave tomorrow or today, something like that. No, what and what I was told that there was no money. It's not as if there's a money issue to fix the air conditioned units. You know something? I keep on telling you people on this platform here, you know, that we blame politicians for their hands in the public kitty. But we are not blaming permanent secretaries who is to be blamed also, because some of them hands in the public kitty. We're not blaming them. The young lady is supposed to do an emergency surgery. Well, I would say an emergency surgery because she has scoliosis. And you're telling me that the person who's in charge of the Bustamante Hospital couldn't pick up their phone and call a hospital around Kingston and ask if the operating theater is up for use. Can we use operating theater because our thing here not working properly? You couldn't do that. I want you to listen to something here. And I wish I had the proper. I was trying to get the video down a bit better, but it can't. For some reason, it's not coming up the way how I want it. But let us see something here. I want you to listen to this. The doctor from the United States, Dr. Brady. Dr. Brady, who always come to Jamaica to do this. Head of the medical mission from the United States, Dr. Robert Brady. The man is frustrated because the person at the Bustamante Hospital didn't see it fit. Maybe there's something else why the CEO of the Bustamante Hospital decided to make it go public. I want you to listen to this.
There are some amazing people here at this hospital. The doctors, the nurses, the physicians, the residents, and we take great care of these kids. But there are some clear infrastructure issues here. Okay, I've been coming here for 20 years. There's some very clear infrastructure issues that need to be solved. You know, I made a request 2 months ago when we heard the air conditioning issues. We need to fix it, or you need to make accommodations somewhere else. Now, the fact that they want to make accommodations, make the decision today to do it tomorrow, that's not right. That's not right for the patients. You know, and my request was ignored. So I think that if you know, this is the only children's hospital currently on the hospital in the island. We're probably the most technologically advanced Caribbean island in healthcare wise. We have to be the gold standard. Our hospitals have to be the gold standard. And we have to, people come from other islands so we can take care of their children because we know that our healthcare system is good and we have to maintain that. And so we have to go through the hospitals, make sure you're absolutely correct. The autoclave systems are working. We can only do single instruments now. That's an issue. The air conditionings have to work, and we understand this is an old hospital. There's other things that we need to do to fix it, but these need to be addressed and fixed, and the money needs to go into helping these children. And I come here twice a year. I bring a whole team where we donate thousands of dollars of equipment because we want to help these people. And you guys have to put the infrastructure in place for allow us to do that. It's absolutely necessary. There are some.
It is a damn shame and disgrace. It is a damn shame and disgrace. And that is why the American government put a travel restriction against Jamaica. And things have a way of coming out, I hope the ambassador for the United States, Ambassador Audrey Marks, is seeing all of this. Because she believes that is a protest in the United States led by Wilfred Rattigan, myself and others. That we are the one who caused a travel restriction. I hope Ambassador Audrey Marks is seeing what is going on. The negligence of the people of the Bustamante Hospital. Maybe there's more to this, Maybe there is more to this that we don't know about. Maybe there is more to all of this that we, the Jamaican people, don't know about. But I want you to listen keenly to what Dr. Robert Brady had to say. The person who comes to Jamaica to help with this young lady surgery. She has scoliosis, a very dangerous spinal problem. Here it is. There it is. I'm going to play a video also about scoliosis. It affects you. And the mother is getting help for her daughter to do this surgery, free of cost. Now the question to be asked this morning. The question is to be asked this morning. The doctors who came down to do this surgery have to go back to the United States. Is it that the Jamaican government will take up this responsibility to pay for the young lady's surgery? Huh? The Minister of Health said there is no problem and no money problem to fix the air conditioning. Is the people who then get to fix the air conditioning them dragging their foot? That's what the minister said. So that means that somebody within the Ministry of Health or somebody at the Bustamante Hospital who is in charge of the air condition unit, who is in charge of maintenance of the hospital, they must get their friends and cronies. It's going to cost this country, To me, this morning I was thinking, and I decided I was going to call a friend of mine who's a medical doctor. When we were building the Chrissy Thomason Memorial Hospital in the Cayman Islands, I was there. I helped to build that hospital. The air condition that runs the operating theater is different from the air condition that runs the main ward. The air condition that runs maternity ward and the general ward is different from the air condition that runs the operating theater. Now we all know Bustamante Hospital is an old, dilapidated hospital. And government is to blame for other things too, you know. Because when Shaggy decide to do all those things for Bustamante Hospital, you know what happened? They call on Shaggy and say Shaggy must give an account for the money. The money has not been handed over now, do you know? Because there's no accountability. If Shaggy hand over to the money to the people in the Ministry of Health, I'm telling you something, you know. I keep on telling you, know. So we blame politicians, we not take up for them handing a public kitty, and we're not blaming the permanent secretaries. The permanent secretaries must be blamed. And the maintenance managers of the hospitals is to be blamed. That money has been handed over. What I get to understand, because there won't be any accountability for it. Forget about Shaggy money. Why is it $1 trillion is unaccountable for in the office of the Prime Minister? How is it that they can't fix? They keep on putting a band-aid. They keep on putting a band-aid on the system in our country. What they need to do at the Bustamante Hospital for Children is to get rid of the old air condition unit at the OR. Put a different air condition system. As I said before, and nobody can come tell me say nothing go so. The operating theater air condition is different from the maternity ward and the general ward or the pediatric ward. The operating theater air condition is different from the maternity ward, the general ward, or the pediatric ward. The air condition of the operating theater must be different. It has to be a different system because it can't have bacteria blowing in on the surgery. When you cut a patient, it's bacteria coming down inside there. No. You kill off the patient. It has to be a different system. And those who are in charge of the Bustamante Hospital is to be blamed this morning of the negligence. Because everybody have to near my food. Everybody have to near my food. It's same way at Savlamar Hospital. There's a problem down there now with the operating theater not working because the air conditioner not working down there. Dear God Almighty, it look like from them build all these hospitals. I keep on telling you people, you know, we cannot blame one party for Jamaica's fundamental problem. Based on what I'm hearing, that the Savlamar Hospital air condition unit has not been changed since it came into inception. I repeat again. What I get to understand, lie or true, I don't know. I need to do some more research. It's alleged that the air condition unit at the Savlamar Hospital operating theater has not been changed since the hospital opened its door. That's what I'm hearing. I am going to get a hold of 2 medical doctors in Jamaica. I tried to get a hold of them this morning, but they were busy. To come on air and tell me if what I'm saying is true, or am I lying? The air condition unit for a hospital, for the operating theater, has to be independent from any other air condition unit within the building. And it cannot be that in 21st century Jamaica, that we can spend an amount of money to fix air conditioning in this country. You expect that a minister must drive around to every single hospital? Which I got they can do it. But majority of the things to be blamed is to be blamed with the whoever is managing the individual hospitals. And this morning, I believe that the person who's in charge of the Bustamante Hospital is to be blamed. I have a call coming in here. Hold on a minute for me, please. I can get this call here. Hold on for me. Good afternoon, caller. Welcome to the program.
Good afternoon.
Yes, sir. Go ahead.
Balancing the life, balancing the books, but we're not balancing the life. What's going on?
Boy, I don't know. The center cannot hold me and I keep on the land.
Well, I can tell you. This. It's no surprise. My uncle was in the Spanish Town Hospital.
Yes.
Around 2 months ago, he died, or less. And while he was on the ward, if you need any form of water,
God help you.
No. If you want water, you could get water because every patient inside there sweat.
Lord have his mercy.
You know, and there is some ceiling fans, and those ceiling fans were ceiling fans from I used to go to primary, Alpha Primary, I saw Camp Road back in the 70s.
But I'd like to know something though, Garfield. Mr. Caller, sorry, caller. I would love to know something though. How is it that in 21st century Jamaica, that our medical system in this country, every 5 years is the same damn stupidness? No better barrel, no better hearing of people vex when I say these things. The health sector in this country is out of work. And it cannot be out of work within 18 years. Within 8 years. It has to be something that's been going on all along.
Correct, 100%.
It can't be one administration make the system out of work, sir.
No. Jeffrey, the problem that we're having is that the CEOs of these entities don't really care. And I shouldn't say they don't care. They are not having dialogue with their entire staff.
Thank you.
And they need to create a team to go around to pay attention to these low-hanging fruits issues. Because to put in a split unit, and I don't believe the operating theater is bigger than your mansion, Jeffrey.
I wouldn't even answer you,
Right? So, them could have handled this much better. You have a doctor and his team inform you. He was told what's going on. You shouldn't really let the doctor arrive and this surgery could not be performed.
Let me ask you a question, Garfield. Do you believe that the management of the hospital have to wait until the minister got involved to call UWI to ask if the operating theater is available? You don't believe that the management of the hospital should call you, not the minister?
Well, what the minister should do, should ask the resignation for the person who run the hospital. You know?
My God.
Because obviously there is no accountability.
Right, and that is why I keep on telling people, that I will not come on here and blame a person. I have worked in a hospital before. The buck stop with the person who is in charge of that hospital, not the minister.
Yes, sir.
The CEO of that hospital is supposed to take up the phone and call University of West Indies Hospital and say, listen to me, we're having a problem here at Bustamante. Our operating theater air conditioner not working. Can we borrow your operating theater to do a surgery? Why can't the minister call?
Jeffrey, the reason why the CEO never called, because that child wasn't Jeffrey Tavares.
Oh. Oh.
I mean, if it was somebody daughter from Crossroad,
hold on for me. I am not saying that the minister did not know that those group of doctors was not coming. What I am saying this morning, and on must look into things, and pick sense out of nonsense. I am the Minister of Health. The call on the line is the CEO. Charmaine is the maintenance manager for the Bustamante Hospital. The CEO is to let the maintenance manager know. Listen to me. We have to get that air condition fixed because we have some doctors coming in. Why everything we blame ministers and blame ministers? Blame the permanent secretaries too. Am I right, Garfield?
Well, I will break wrong with you.
Okay,
I believe the permanent secretary don't work at the hospital. He or she work at the ministry.
Right. True.
The hospital should have a team in charge that a maintenance crew, not somebody who come in to work on demand, somebody who is there every day. 12-hour shift. A hospital is a 24-hour business. You need to have a representative there who is competent into HVAC, plumbing, and so forth, carpentry, and for the most part. And this person should be on the job every day, 12 hours a day. Because it's an entity. The government, the minister referred to the hospital as a plan.
Mm-hmm.
When you go to a backside plan, the superintendent don't stay from the yard at Timbuktu and run the machinery.
No.
He's on the ground. The truck driver don't stay in the yard and bring the aluminum and the dirt to process the aluminum from Timbuktu in a bedroom.
Yes.
You need to be there. So that is the problem. So if they had somebody on staff or a crew who is regular doing maintenance check, this should have been taken care of. Simple as that.
So everything lies with the management of the hospital.
Correct. It's a management issue. That's not the minister's issue. And the minister, no, how it becomes the minister's problem is when the minister allowed the CEO in the position this morning.
True.
You know what I mean? But
hold on there. You see, people still not understanding this, I did not say that the minister did not know that the doctors were coming. You are saying to me that the minister must know that every single hospital air conditioner now work?
No, utter nonsense. The minister don't even need to know if the doctor is coming in the island.
Thank you.
You know what I mean?
I'll tell you something. When I was in the Cayman Islands, when we have specialists coming in to the Chrissy Thompson Hospital, all right? The CEO, the owner for the hospital is Dr. Tomlinson, I can't call his name. Yeah, although he no longer owns, he sold it now. But the CEO know who is coming from who is not coming. The owner, who is Dr. Steve Anthony Tomlinson, don't know which specialist is coming unless he may come and look at the appointment book and say, okay, Dr. Tavares is coming in today, man.
I don't know.
You hear this one of him, not say me a doctor. Here and now. So when we're saying that the minister should know, isn't everything the minister should know?
Not at all.
Huh?
No, the minister.
So when it comes on to the whole entire thing of what is going on at Bustamante Hospital, the person who is managing the hospital should be fired. Because the fact of the matter is, you know that these doctors were coming. You knew that they're going to have a surgery. And based on what based on what Dr. Robert Brady of the mission is saying, that he spoke to them 2 months in advance.
Right.
So if he spoke to them in 2 months in advance.
But when I hope referee, Dr. Brady stay in and come and take your young girls.
You're breaking up, I can hardly hear you, Garfield.
When I will hope and pray for is Dr. Brady to return back and carry out his good deed.
I think he's going to return because he said in an interview that he has donated thousands of dollars of equipment to the hospital. But I think what we need to do, though, it's a shame. It's a shame and disgrace this morning. What we need to do in this country, Bustamante Hospital for Children is the largest children's hospital in English-speaking Caribbean.
And not only that, as done, and this.
No, hold on, Garfield. Garfield, you're breaking up big time. Stay one place, no man. Or is it Jubilee?
No, I need to do a surgery. So I need air conditioner.
Yes, go ahead now. What are you saying now?
What I'm saying, that is why people like Shaggy, I mean, has done so much good for the Bustamante Hospital. And because of the board wanted to dictate how the man money is spent that he has raised. You understand? These are the things that turn people off. You know what I mean?
And a lot of Jamaicans don't understand that it's the board who is doing all of these things. You know, don't have to be the minister. I mean, the minister involved in it, I don't know.
Well, somebody like a doctor, the surgeon, who is not even a Jamaican, his parents are Jamaican.
Right.
And he's compelled to come back to his parents' country.
To assist.
To do good for the people. You're supposed to roll out the red carpet for this man. And what red carpet is he asking for? Proper working condition. That's all he's asking for. You know what I mean? Yeah. So, the government need to anger them bangle, man.
Yes. And fire who to be fired this morning.
Yeah. It's a sad case.
We can't have people sit down and collecting taxpayers' money. Majority of the problems that we face in our health sector comes from those who are working in there.
Let me tell you this, Jeffrey. Something that I've experienced. And when you go into a hospital in the great United States, and you see a nurse coming, and you ask the nurse a question, the nurse stop and assist you and help you.
Yes.
You see a doctor. People, doctor, nurses in Jamaica and CEOs in government agencies believe that they are God Almighty.
Oh, yes. They treat everybody like, you know what?
And they don't want, and you are not on their level to have a conversation with them because you are not a nurse, you are not a doctor. And when you look how the higher ranks of the medical profession treats the lower ranks in the hospital, you will get the answer why the hospital in the medical industry deliver such poor service. Because you don't make everybody. I don't know if you know this in a Jeffrey.
Yeah.
And I have seen this. There are two types of uniforms I see in the hospital. They wear pink and white.
Midwives and that kind of something, yes.
No. I don't know about the midwife, but the pink uniform employees, they are like patient tech.
Okay.
Are you aware, Jeffrey? Them can't hang out near the doctor at the room.
They can't do what?
They cannot go in the doctor's lounge. You know that?
Yeah, I'm aware of that. Yes, I think it happens in most medical facilities.
All right. Why you ask another question again?
Yes.
Why you drive to North Broad Medical Center?
Yes.
And say if it's in a sign say Chief Upper CEO in the parking lot.
No.
All right. Why you go to Jamaica? I go to a church. I say pastor this, deacon
yes,
this,
yes, man.
this. The problem that we are facing in Jamaica is too much descriptive heads of power.
And then they're not doing a damn thing.
And they are not doing anything. And that is one of the problems we are facing. Because they believe that they are God Almighty, and when they are God Almighty, you must bow down to them. Just like your President Donald Trump.
Hello, please.
I'm just saying, that's a joke though. But what I'm saying, we need to respect everybody. And when we respect everybody, we will have a better society. That's all I'm saying.
But you're correct, you know, Garfield. And when you look on the whole scenario of a medical team that is gonna come down to a country, a third world country, a country where his parents was born, and he bring down a team to help people, and our health system in this country is out of whack because of people who are in the facilities, the CEOs and the managers and maintenance managers who are collecting taxpayers' money for little or nothing. Now do nothing. Them is to blame too.
You see the person who is responsible for maintenance in the Department of Health?
Yes.
I guarantee him drive a brand new 2024 twin cab pickup truck.
Or a Prado.
Or a Prado.
Or maybe a Benz.
And when they look in the cab, him don't even have a saw.
There you go. Not even a screwdriver or a screw.
So trust me on that, Jeffrey. Come on, assault, my friend. I want you to walk behind Spanish Town Hospital parking lot, and you see how many broken down vehicles, Ministry of Health. Good vehicles need to be repaired. Ambulances can be repaired. I myself, and what they do with them don't repair them, but them sell it off to their friends and cronies.
Yes.
And the friends and cronies repair them.
Yes.
And what the friends do, when one brought them, use one to repair one, and then them get it at a vast discount price. So there are low-hanging fruits the government can act on. But the truth of the matter, for the government to act, the CEOs of these organizations, I remember, the health sector in Jamaica, I think is breaking up in 4 zones.
Yes.
There are several.
Yes.
3 zones. There are 3 zones.
Yes.
So you have to get to those heads in the zones. So those are those people. But the truth of the matter, Jeffrey, when you are politically appointed, this is the results you get.
Yes.
And mark you, both party does it.
Of course.
Do it rather. Both party, that's their modus operandi.
Hello. And people,
both
a lot of people on this platform now come up when I say this,
What part?
The biggest milking tree for the two political parties to put their friends on crown is JUTC.
Not only, well, JUTC, not only it's just because it's a big entity, but you have the housing trust.
Oh yeah.
You have RADA.
Mm-hmm.
You have the tax department.
You have civil aviation.
Civil aviation. Yeah, I mean, that's where I go. So when you get a position,
Me? Hello, I don't want a position for nobody. Like how I don't want no order for jackass.
But anyway, Jeffrey, I have to do some work now because I have to balance my life and balance the books, you know.
All right, my good friend.
All right, good.
Cool. Boy, I have to take that call a while ago from a friend of mine who is a Jamaican by birth, but live overseas and continue helping this country as much as he can. I want to say good morning to my good friend, Miss Campbell, Miss Abigail Campbell. How you doing? The numbers to call into the program. I open the phone line. I don't open the phone line. Everybody can call in and tell me what you think about what is going on in Jamaica. This healthcare system here. Everybody's saying that the buck stopped with Minister Christopher Tufton. I don't believe Christopher Tufton should know that every single clinician that working in every hospital. If the maintenance manager don't tell the CEO and the CEO don't tell him or tell the PS, him not gonna know. I'm not taking up for him. Don't get me wrong, me not take up with nobody. But the truth must be told. I am the manager for this hospital. I preside over 14 parishes. And the 14 parishes have how many hospitals in there? And if them not come tell me say that now work, me not gonna know. Those managers and maintenance managers of the hospital, if they're not doing work, they must be fired, man. And that's what Garfield said a while ago. Some of them that drive brand new 24 Prado and Beamer and X6. And I think a screwdriver inside here. But what I want to know this morning though, Ambassador had remarks. Is we bringing on brand Jamaica, ma'am? Ambassador, is the people who demonstrate about this system in Jamaica, is them bringing on brand Jamaica? Is we make the American government put a travel advisory against Jamaica? We're the one who did it this morning. A Jamaican citizen can't get a surgery done. A CEO of a hospital didn't see it fit to call one of their counterparts to find out, is your operating theater available because my one is not available because the air conditioner not working. They didn't see it fit to do that. And those CEOs and maintenance managers getting how much $1 million a year for not doing one damn thing. When a person has scoliosis, is a very serious problem. Very serious problem. Like I said, if I can find a video here about scoliosis, make you watch it. This is a very serious problem when you have scoliosis. It bends your spine. You know, so when I come on this platform, contact on something, you see, it irritates the living hell out of me. I keep on asking. Have the UIC put up any candidate to run in the general election? Have the UIC put up any candidate to run in the local government election that gone? So how is it that Jamaica's two choices, the UIC and the PNP? Jamaica's only choice is the PNP and the Labour Party. Not UIC. Because UIC can't tell the people of Jamaica who are their candidates in the 60-something constituencies. 60-something? Huh? So how is it that UIC must be Jamaica's choice? I behave myself this morning. I can see if I can find this thing here. I can see if I can find this video about scoliosis. Because a lot of people don't understand the seriousness of this thing. And I can tell you one thing though. It's either they buy some brand new air conditioning unit. Buy some brand new air conditioning unit for the hospitals in this country, the operating theaters. If you don't buy something for the operating theater, good God in heaven, he's still chatting. Then it don't make no sense because you can't, there's no way you can, there is absolutely no way you can operate on a person. And why is it that, another thing again, why are they using fans in air condition in hospitals? You're saying to me that, that Jamaica can't build a solar system for the hospitals? Huh? They can't do something. No man, something not right here. Something not adding up here. We spend how much millions of dollars. I am not talking about how much money get to how much money, whatever. We must be fair. Those people who are CEOs for the Cornwall Regional Hospital, the Montego, the Sablama Hospital, the Bustamante Hospital, them have some weight to bear too. Them have some weight to bear too. I want you to listen to an interview done this morning. An interview done this morning. Someone may come off of the platform when I done. But so be it. I want you to listen to an interview done this morning by the minister himself on a radio station. Listen to this.
A storm created by reports of faulty air conditioning in the operating theatre at the Bustamante Hospital for Children could have been avoided. He was speaking at a media briefing on Thursday that surgery for an 11-year-old girl with an aggressive form of scoliosis had to be postponed due to air conditioning issues in the operating theatre at the hospital. It was to be carried out by Straight Caribbean Spine Foundation, a U.S.-based charity that was formed in 2006 to assist the children in Jamaica who are faced with complex spinal conditions. Founder of the foundation, Dr. Brady, decried the fact that his team was unable to do their work due to an air conditioning problem he identified 2 months ago. But Dr. Tufton says all that needed to happen was for the Bustamante Hospital for Children to reach out to all the facilities for the surgery to be done. Tufton, we spoke just now of the 11-year-old girl. Is that the only patient who was unable to have her surgery done at the hospital because of the air conditioning issue under this mission?
That's the only one I'm aware of, brought to my attention by the media. As it relates to the mission itself, I'm not sure if others were similarly impacted. I know a number of surgeries were in fact done. And in this case, because of the complicated nature of this case, it was said that it would take much longer than the average, and there were some condensation issues with the operating theatre, which led to that delay. So I'm not sure if others were, but I know a number of surgeries were
And in relation to this patient, I know that you reached out to University Hospital of the West Indies yesterday to have the child transferred to that facility and have the surgery done. What's the update on that this morning? I did hear you saying yesterday that she is a complicated case, so particular things would have to be done before in terms of prepping. What's the update on her this morning? Will her surgery be done today?
Yeah, right. So, yes, the University Hospital had agreed yesterday and had put in place the team at that facility, and they had done other things that were necessary. So I've been some dialogue with the visiting team and the Bustamante Hospital for Children, which should have taken place yesterday. And I'm actually out of parish now. I'm not sure. I haven't gotten a brief since today, this morning. So I'm not sure where it is. But I know at the press briefing, the lead on the mission had said that it may be a challenge because they had to put some other things in place. Now, what I indicated in consultation with the university that if they couldn't do it, then we'd make some other alternative arrangements to have it done. So I think we agreed that we would solve that particular problem, but the opportunity was there for me to raise the more systemic issues, which I think would have created a situation like this to occur.
And if that child now misses out on the opportunity to have the surgery done under this mission, which her and her mother would benefit from for free, who puts the bill?
No, we would have to find a way. I think it's important to solve this particular case, and we will have to find a way to ensure that this case is solved. I have gotten involved, and I will ensure that our facilities come back and our efforts will address the issue. Because the case raises several questions about other things, and we would want this particular child to be a victim of some of these inefficiencies that exist that created this discussion.
Meaning the government would be willing to pay for it?
Well, I am the representative of the government, so yes, we would have to get involved now, whether we coordinate with another institution, whether internal or external. If there are resources that are needed, then we'll have to find a way to make it happen.
A lot of people are focusing on the timeline, Dr. Tufton, of this matter, that the mission was coming. The founder indicated about 2 months ago, he said that here are these AC issues with that theater. We wouldn't be able to operate there, find some other alternative so that we can have the surgeries done. But it was left up to you to make a call yesterday to have things expedited. Isn't that a bit unacceptable, though?
It's highly unacceptable, highly. Which is why I think the press briefing was held. Not think, but just.
You see, it takes the minister, and people not understanding. People say Tufton this and not Tufton that. Yes, Tufton do something what we not like. But the CEO of the Bustamante Hospital should be blamed. Why didn't the CEO or doctor take up the phone and call University of West Indies and say, listen to me, we have a problem here. Can we use your theater? Nobody now see that. The minister shouldn't have to call University of West Indies operating theater to use their theater. And him to do it. It's not him supposed to do it. It's the person who's in charge of the hospital supposed to do it. The person in charge of the hospital is supposed to do it, not him. A medical person supposed to do it. This country of ours is gone. The person who's in charge of the Bustamante Hospital should be fired this morning. It's his or her negligence. Dr. Brady from the United States told them 2 months ago that there was an issue with the air conditioning unit. And the person in charge of the hospital didn't know a damn thing about it.
Right, achieved it. There are a number of issues that are at play here. First of all, it's a child who we can't allow to be a victim of the system. So when I saw it, I tried to reach out to try and resolve the issue as quickly.
Let me ask you a question. People, you see me, I'm a very fair person. Very fair person. How many hospitals are in Jamaica? You own a company. You own a company, a multi-billion-dollar company. All right. Take Donald Trump, for example. Donald Trump owned Trump Towers and owned a lot of hotels across the United States. You think said Donald Trump would know say his golf course in New Jersey, the air conditioner not working at his golf course? They have maintenance managers. Maintenance managers. They have maintenance manager people who know, yes, many of us don't like Tufton, so be it. Not take up to nobody. But what was happening now? The CEO of the Bustamante Hospital is to be blamed for all of this. They knew the air conditioner wasn't working. They get people to come and fix it. The person drag out their foot and not fix the something. The CEO of the hospital should be fired, and the maintenance manager. They are the one who's in charge of the hospital, not the minister. And we must look into things. 2 months. Dr. Brady said to them the condition was not working. And they know he's coming back down to do a surgery. They know Dr. Brady's coming back down to do a surgery. Come on, people. Is that everything a person gonna know? You have Cornwall, Middlesex, and Surrey. In the 3 counties, how many hospitals are in the 14 parishes in this country? So if I not drop off of one building, the minister must know to not drop off of the building. The people who are in charge of the hospitals, they don't give a damn about the people. The maintenance manager who is in charge of the air conditioning unit at various hospitals around the country don't give a crap about what is going on. Those who are put in charge under the minister is to be blamed. If they did not get the money to fix it now, then you blame the minister. But the Gleaner report that there was money there to fix it. The Gleaner report there's money there. There's money there to fix it. And the maintenance manager must call in somebody. And the person then drag their foot. And they know they have surgery, they have backlogs of surgery. Blame the maintenance manager and the CEO. Fire them backside. And them to be fired. We have some people in this country who is politically appointed, you know. And in some position in this country, they're not fit to be in there. The CEO should take up the phone this morning or yesterday. The CEO, when they found out that the air conditioner not working and the air conditioner will not be fixed in time, the CEO of the hospital, of the Bustamante Hospital, should make some preparation with another hospital for the surgery to be done. Why the CEO have to wait until the minister hear about it? For the minister to pick up his phone and call Bustamante. Yes! They call private company. at the appointed time, the maintenance man should be fired. There is absolutely no way the Minister of Health should know what is going the maintenance department not had this. The maintenance department not had that. Every single hospital is given a budget. If the money not good on the hospital, then we can't complain to the minister fault. Thank God it's Friday indeed. I get some rum drink. But money is there to fix it. It never fixed in time. And the CEO sit down and drag his or her foot along with the maintenance manager. The CEO of the hospital didn't even see it fit to pick up the phone and call another hospital to ask for help. The doctor traveled from the United States and couldn't do the surgery because the CEO sit down on his or her backside and drag their foot on so they can now work. Tell you know. I keep on telling you this on this platform, you know. And all the while, me not take up no politician, but all the while we can blame politician because we have some people in the ministries should not be there. You see? And all of this that happened at Jamaica. That happened in one administration. It happening from Wapi kill Philip. If you not think, say, I know all of these problems that happen in this country, make a sad mistake. You make a sad mistake. If you don't believe, say, Jamaica's health problem just start happening, you make a sad mistake. A long time this is going on in this country. Long time and they don't know nothing about it. Long time. The CEO of the Bustamante Hospital and the maintenance manager should be fired this morning. Because if the maintenance manager went and tell the CEO, say, listen to me, the operating theater air conditioning won't be up when those doctors come down here or whosoever have coming down here or whatever. Just say it won't be up because no surgery can done in there. And from the maintenance manager, tell the CEO that the CEO should say, okay, call the nurse who is in charge. Because you have a charge nurse. You have a charge nurse who is in charge, you know. I have a doctor who is in charge of operating theater too. Have a meeting and say, okay, how much surgery we have set for operating theater 1 or operating theater 2. All right? And when the charge nurse or the person who's in charge of operating theater say, okay, the director of nursing, okay, we have this, and we have some doctors coming down for this. Then me as the CEO say, okay, let me call Andrews Memorial, let me call KPH, or let me call University of the West Indies to see if they can accommodate the surgery. You did nothing like that. So what you all are telling me on this platform now, that is Christopher Tufton must go in there. See, say, that now work. Call meeting and say, oh, that now work. And pick up the phone and call the hospitals. And you must think, in the medical field, you have a director of nursing. You have a person who's in charge of the hospital, who's called a CEO. They should carry out their duty. And the maintenance manager come and tell the CEO or tell the nursing director, so listen, madam, whatever you want to call her, whosoever. Operating theater 1, 2, and 3, air conditioning that won't be up. Then they are gonna call a meeting to see how much surgery how much surgery we have in place. I'm gonna go ask the doctor what think I like Jeffrey to tell. I work at Chrissy Thomas Hospital for many years. I have to build a hospital in Cayman. I'm around doctors. I'm not speak for no minister. But the truth must be, the people must have common sense. If the maintenance manager must relate to the CEO, and the CEO must relate to the director of nursing and call a meeting. Good afternoon, welcome to the Mek Wi Talk program. You're live.
Good afternoon, Jeffrey. How are you?
Hi, George. How are you doing?
Oh, not bad. You know what I'm really concerned about? When Tufton asked him how long did they have an air condition problem, his response was over 10 years.
When he said that?
He said that, listen to the whole interview when they were in front of the camera.
No,
and the doctor was sitting.
Hold on for me. I was in front of the interview this morning. Anyway, go ahead.
Mm-hmm.
Go ahead.
Yeah. So last night, what's his name? Last night played it on Partner Draw. They played the whole interview, and Tufton looked to the doctor who was in charge of Bustamante and asked him, "How long have you been having this AC problem?" And he said 10 years.
Oh, so that, you know what that means now?
Mm-hmm.
Common sense must prevail. Who's to be blamed for that?
The person in charge of the hospital, not Dr. Tufton.
Thank you.
Because if you have a hotel or a business, you have people who take those stuff, who's in charge of those stuff, and they're supposed to bring to you, okay, this is a problem, that's a problem. Who to tell if they haven't got the money and they used it?
Okay, because based on what I hear, I do some investigation from last night, you know.
Mm-hmm.
And the person to me said, Jeffrey, me not take off a Tufton either, but the money is there.
Mm-hmm. Mm-hmm.
The money is there.
Because if you have a home, if the cook don't tell you what he needs to cook, you won't know.
Thank you.
It's common sense.
You have a maid at your house where the maid go do shopping for you and everything, food and stuff for you. If the maid come and say to you, say, okay, Mr. Tavares, you don't have, but we need to get someone to go get by XQZ. No, you're
never know, because guess what? You pay the person to do that, so you're confident that they're going to do what they're paid to do. You see? So he can't micromanage everything. He's not my favorite person, but he cannot micromanage everything. And there's no way for him to know that unless someone says something.
There you go.
Well, that's my 2 cents.
Don't move yet, darling. If someone don't come and say to him, if someone come and say to him, say, look here, minister, that not working or that not working, I'll go to the permanent secretary of the Ministry of Health and say, listen to me now, madam, whatever your name. We're having a problem with air conditioning at Bustamante Hospital. Them not gonna know.
No, and if they're not putting it in the report for him to read, he won't know. So if I don't have a paper trail to say, okay, he did send this information to me, but it was sent.
What a lot of people don't understand. They believe that the minister going to every single hospital and take notes. Say, okay.
No, he can't micromanage.
Jesus have mercy, God.
There's no way he can micromanage. That's a big business, and it takes a lot. So that's why they hire people to do that. But I think that guy should be fired. He was there with him, and he looked at him and said, how long are we having this AC problem? He said 10 years.
So that means this the one when the other party was in power too.
Mm-hmm. So listen to on Partner Draw where he played it when Tufton asked the hospital manager.
I was searching for a lot of things, but I couldn't get some of them what I was searching for. I'm gonna get it. But the truth is the
Okay.
truth. The minister alone can't do this.
No, it's unfair. You have to be fair whether you like somebody or not. You just have to be fair.
If report don't come into me, if the report don't go to, okay, if the maintenance manager don't give the CEO the report and the CEO don't give the report to the PS, the permanent secretary, and the permanent secretary don't give it to me not gonna know as the minister.
No, you won't know. It's not like he can go there and go check everything. Maintenance, what? Yeah, that's not the job. They pay someone to do that job, and they didn't do that job. They should be fired.
I tell you something, you know. A lot of people don't like certain people because of political whatever, you know. And they will do this and do that, you know, and blame this and blame that. But what we must do is speak the truth. And
we have to split justice.
Split justice. The CEO and the maintenance manager is to be blamed for what is going on.
I just hope they take care of it. Yes. And get rid of this program. Put the money where it needs to be.
Indeed.
Okay,
Indeed.
bye.
Thank you very much. If Tufton never give no money towards that, then if they had put up the thing and say, okay, we don't get no money to do this, then we don't blame Tufton. But the CEO of the Bustamante Children's Hospital, along with the maintenance managers, to be blamed. Is to be blamed. I'm not care who wanna come back from my program because I'm a liberty for no business. One want to that's up to no. We must split justice this morning. We must split justice this morning. How on earth can you have a hospital running and you know what is going on and attack? We have no hospital for true. And there's no way the hospitals could run down under one administration. No way. There's no way. The hospital could be run, all hospitals in Jamaica under one administration, sir. For 10 years. Good God Almighty. Remember I said to you, know, it was told to me that the Sablamar Hospital operating theater air conditioned unit has been there since they opened the hospital. What I know so far in a hospital setting, and I ask anybody, the operating theater air conditioned units should be different from the general ward, maternity, or wherever. It is the biggest children's hospital in the Caribbean. And the CEO and all of them down there. Sometimes you wonder. Aye, boy. Sometimes you wonder. Let's go back to some more of what the interview was saying. Because somebody listen to Tufton to me not like either. But listen to this.
But perhaps more fundamentally around the system and the service provision within the system are some issues that are systemic and culturally needs to be adjusted as we seek to build out public health with the millions of dollars that the government has spent and committed to spending to modernize health systems. For starters, no one institution in Jamaica operates on its own in public health. It's a hub and spoke system from primary to secondary to tertiary. And Bustamante Hospital for Children has always used the University Hospital as an overflow during peak demand, whether it's dead day or otherwise. And we waive fees for young people up to 12 years old because that's what that's the cohort that they choose to facilitate those peak periods. So it's not unusual. What it requires is management and leadership to find a way to make it happen. I understand that there were some discussions. I'm not sure why those discussions weren't done in a timely manner to accommodate the mission, because the mission was going back during a period that they're going back today. So that's one issue, the management leadership issue challenges. The other is why the institution itself did not have an air conditioning unit, having had a defect from April of this year. Now, I am prepared, because of what I know systemically, to not blame the institution or the management for that issue. And I said that. The fact is, when this problem was discovered back in April, a firm, an external firm, was contracted to solve the problem. These are experts in cooling and refrigeration and so on. They failed after 5 months, and they were terminated, and a second firm was hired, which had promised to do some work within a relatively short period of time. And my understanding is that their deadline also expired. And so the efforts were made, the resources were available, but the problem was with the provider of the service. Now, this is a real problem, not confined to Bustamante. We have it at Victoria. In fact, I am actually disappointingly astonished that in terms of the service provision for refrigeration, air conditioning, and so on, I am yet to come across one company in Jamaica that we deal with in healthcare that has not missed deadlines, that has not created significant.
Another thing again that people must understand, is not any normal air conditioned unit must be used in an operating theater, You have to have the right condensing, the right cooling system, that it don't breed bacteria. A lot of us don't understand that. I didn't know that until I was working at the hospital in Cayman. When it was being built, I was there. You have to have a different type of system for an operating theater. It does not breed bacteria. Some more of this.
Significant delays around sourcing parts because they store the risk of inventory in the health system. In other words, they don't carry inventory. They have to order parts when they are needed. And sometimes we're told that we have to wait 2 months, 3 months, 5 months. They have to fly people in from all over the world to do examination because they have limited capacity on the ground. Maybe because they don't invest in training people. And it is a real problem. And we're going to have to find a way either to keep them, to get them to adjust their modus operandi to build that capacity, or frankly speaking, to find entities or individuals, whether local or foreign, who can do that. And that Bustamante issue for me was a good opportunity to raise again the dilemma that we face in how we maintain.
What on earth is this? Hold on for me, please.
Okay, yesterday to hear what is going on. And I know I haven't had a chance to speak with them.
Hold on, please.
Everyone thinks kids are losing.
A storm created by was on situations where you have.
What I know so far, and I'm not going to run on anybody on here. I'm not going to run on anybody on here. What I know, anybody can go Google it or whatever. An air-conditioned system for operating theater is different from the air conditioner that is being run at the hospital or a plain air-conditioned system that I know so far. I'm yet to be corrected on that. It has to have a different condensation for it, that the air does not breed bacteria when they're doing a surgery on a patient.
hospitals that are waiting 5 months and longer to have air conditioning units fixed in operating theaters where critical surgeries need to be done?
Okay. So, first of all, I think there needs to be a dialogue with the critical supplier stakeholders. That process started sometime earlier this year. I met with most of the larger ones, and we had a conversation. They expressed some issues around things like late payments from the regional authorities and so on, and which hampered some of their efforts. We tried to address some of those things, but I made it clear to them too that we are going to have to review the contract arrangements we have. For starters, the regional authorities have been instructed not to buy equipment without extended service, meaning you buy a piece of equipment as new, it's installed, there must be an arrangement, a contractual arrangement with the supplier to routinely service this piece of equipment. Secondly, though, the extended service and its definition needs to be more specific. It cannot be that a supplier who is the authorized distributor of a part or a system, an air conditioning system, not carrying on island or at least somewhere centrally, maybe in Miami, given that logistics are easy to move things from there to here, critical parts, and essentially vesting under that contract the risk of using the equipment in the health system and the patients and the staff that depend on it, rather than sharing that risk by carrying inventory, which does attract a cost, and therefore being able to turn around the servicing and repairs in a reasonable time. We work in an essential service, and I think we have to be very sensitive to that. An operating theater can't be done for 5 months because a supplier can't have a part for 6 an air conditioning unit.
You hear that now? The supplier who's supposed to fix the air conditioning unit don't have a certain parts. So the minister must be blamed for that too. If the supplier who come to fix the air conditioning unit do not have a certain part to fix the part of the air condition, they have to send go overseas. The minister should be blamed for that too. Jeffrey Labor, right? Mama. Good afternoon. Welcome to the Mek Wi Talk program. You're live.
Yes, Jeffrey. Someone typed on the comment that he said years and not 10 years. But if he knows his years with an S, that means the CEO is aware of the situation.
Thank you.
And if you watch that video, when that CEO said years, it shocked Tufton. Look at the expression on Tufton's face. Just watch that video.
No, but what people are saying that I'm taking up for Tufton and Tufton is lying.
No, you're not taking. You're just being fair. You understand? It's just being fair, because Tufton ain't a good guy, but you can't do bias and make a right decision. We just have to be fair, because I saw the surprise look on Tufton. Just look at the video.
I have to ask about this question. I know I asked it earlier on in your call. I have to ask this question again. You are running a multi-billion-dollar complex.
Mm-hmm.
You are the owner. You have people who you put as managers and general managers and all kind of managers. All right?
All right.
If the air conditioner not working in building 2, you're gonna know about it?
No, you're not gonna know about it unless they give you a report.
Okay.
It's just like if you work in a hospital. If the maintenance doesn't tell the CEO what they need, they don't know. And we have to leave our biases at the door when we're talking about serious situation. This is not a joke. We can always there's blame to be placed, but right there, I can see where he would not know. But look at the interview when he asked him how long, and as a person type that is years, not 10 years. That means it's more than 1 year. So there's no excuse for the CEO not taking care of that.
There you go.
And an operating room is very important in a hospital.
And other people don't understand. that the condensation and the cooling system for operating theater
Definitely.
is different. Because if you
Definitely.
do that, it will breed bacteria.
Exactly.
And when it breed bacteria, the patient
And that will
dead.
cause a patient life. You can have scars, which are hospital disease. And that's caused by not having right
you know
ear
something too? A lot of
and
us on social
cleanliness.
media, you know. A lot of us on social media, you know. Because we have this thing about us, so we are PNP or we are JLP. We can't split justice because only one thing we are see.
That's why I said they need to leave the bias at the door and think critical. This is a matter of life and death. We have to.
You see me, I have a split justice. There is absolutely no way a minister no know whether it be Tufton, Maurice Guy, or whoever come in under the PNP, or Dr. Alfred Dawes. There is absolutely no know how much things now working at the 14 parishes hospital.
No, you never know who you hire if they're competent until they start working.
And when the minister win the election, whoever win the election and they appoint whoever as minister, he don't know half of the people that appoint as minister who's inside there.
No.
He just but there.
It's just a sad situation, and we need to leave our biases at the door and think critical.
And people don't understand, you know. We need to call a spade a spade.
Exactly.
There is absolutely no way Jamaica's health system just happened to mash up just so.
It's just that the next party that came in continued the neglect.
Why I tell you?
It's just a form of neglect.
And that is why I'm saying this. Mark Jefferson Golden, if you and the PNP is successful at the polls, you need to order a forensic audit in every government ministry in this country.
I agree with you 100%, and I hope they do, because Jamaica cannot continue like this.
Order a forensic audit in the Ministry of Health. Order a forensic audit about the money. Order a forensic audit about when I work from when I work.
Well, we just hope and pray that things will get better, because this is very serious and it's not looking good. Okay then, Jeffrey.
All right, my dear. Thank you very much for calling in. I would love for some people to call me. You know. I want the calls to come in. The numbers are 954-529-8030. 954-529-8030. That's the numbers to call into the program. Let's figure out something here. Like up the live feed, hit the super chat, 954-529-8030. Call in and tell us what you think, what's going on at Bustamante Hospital. You're entitled to your own opinion. How dare me to call on your own opinion? You're entitled to your own opinion, so. And this is a program I'm running. I don't call on people's opinion. So you can call in and tell me your own opinion. You can even call me or cuss me if you want to cuss me off. 954-529-8030 is the numbers to call into the program. What's your views on what is going on at the Bustamante Hospital and overall the health sector in this country? 954-529-8030. That's the numbers to call into the program right now as we... By the way, I get to understand the Senate is in high gear. I get to understand that the Senate of Jamaica is in high gear. 945-529-8030. I wonder what is going on in the Senate today. Good afternoon to all those who are just joining us. We're speaking about the Ministry of Health. The gentleman from the... yes, let me play this for you all to let you all know what scoliosis is, because a lot of people don't know what that is. Let me play this for you. You can even call in at the same time if you want to call in, but let me play this for you. You can see what this is. Here it is.
Lower back regions are C-shaped, while the middle chest region has a reversed C shape. When viewed from the back, the spine appears straight. An abnormal curvature in this plane with rotation of the vertebrae is called scoliosis. When comparing a normal spine and scoliosis in this view, you'll immediately notice the abnormal sideways curve compared to the normal straight spine. Although a small degree of curvature is common, anything exceeding 10 degrees in children younger than 10
healthcare-wise,
or 20 degrees for patients older than 10 years is considered scoliosis. The severity of deviation varies depending on the individual, and in mild cases, individuals often don't experience any symptoms beyond the cosmetic deformity. The most common form of scoliosis accounts for 80% of all childhood scoliosis cases. It's called idiopathic, which means there's no specific cause. Abnormal curves found in infants usually resolve spontaneously, but juvenile scoliosis is often progressive and has a potential for severe deformity with heart or lung issues. Studies show that skeletally mature patients with idiopathic scoliosis do not progress when the curves are less than 30 degrees, whereas those greater than 50 degrees do continue to progress. Between 30 and 50, the potential for progression is unknown and individual. Degenerative scoliosis, on the other hand, results from asymmetric disc degeneration. That is the natural wear and tear of the spine over time and affects roughly 40% of the population and is most prevalent in the elderly. This type of scoliosis usually occurs in the lower back with an average curvature of 30 to 40 degrees. Some of the associated symptoms include difficulty standing upright, back pain, and sciatica, which is radiating pain from your lower back into your legs. Children are usually screened for scoliosis during their annual checkup. Doctors will check for any asymmetry between the shoulder blades, as well as the shoulder and hip height. You should be able to draw a horizontal line between the tops of the patient's shoulders and across the waist. Those with scoliosis will not have these straight horizontal lines, and instead the lines will be diagonal. The measurement of interest for scoliosis on x-rays is a so-called Cobb angle. To measure it, one must first identify which vertebrae are at the end of the curved deformity. Their end plates will then be the most tilted towards each other. Lines are then drawn across the end plates, and the angle created from the intersection of these two lines are measured. The measurement is what's being referred to when discussing the degree of curvature. The earlier you treat scoliosis, the better the outcome will be. That being said, mild curves of 20 degrees or less may not experience symptoms beyond some back strain or fatigue in prolonged positions. Those with more pronounced curves are at risk for more severe complications, particularly with patients with curves that are 50 degrees or more in the thoracic region and 40 degrees in the lumbar region. Left untreated, individuals are at great risk for spinal instability, disc herniations, spondylolisthesis, sciatica, uneven gait, and even nerve damage. Bracing has been used to prevent progression of scoliosis. It's typically recommended for patients with moderate curvature between 20 and 40 degrees that is also progressive. Braces are designed to be worn for 16 to 23 hours until the patient is fully grown. While the research behind the efficacy of bracing is variable, it's still considered the best non-surgical option for a growing child, and current developments look to improve the efficacy and overall usability. In cases where a patient's quality of life can be affected, surgical intervention might be necessary to correct a patient's scoliosis. The most common surgery is spinal fusion to stabilize the abnormal curvature of the spine. Modern pedicle screw systems are used to reduce and correct the rotation of the spine. However, the average rate of complication remains quite high at around 22% in patients with adolescent scoliosis. The development of new innovative strategies, including GPS-guided robotic surgery and close monitoring of the spinal cord and nerve root, have resulted in improved outcomes. I hope this video helps you understand the current research on scoliosis. Until next time, this is Dr. John Shen.
There you go. That's a video on scoliosis. It's something that we all must take serious. And I pray and hope that young lady. Good afternoon, caller. Welcome to the program. You're live.
Hi, Jeffrey. Good afternoon. How are you?
I am good.
Anyway, excuse me. I had you on speakerphone, but
You're
listen.
live on air, you know.
Thank you. Good morning, all.
Yes.
You know, I listened to you guys as to what happened at Bustamante, Children's Hospital.
Yes.
That is outrageous. Outrageous. But I agree with you. You see, I don't understand my people at times, you know. Listen. Okay, I'm going to share this quickly with you. When I was youngster in Jamaica and I did common entrance,
Yes, ma'am.
there was a workbook that I used to use that was called reasoning. You remember that? I mean, I don't know if you're from my time. That's what I'm concerned about these days when I listen to my, you know, my people. Sometimes I'm like, my gosh, critical thinking, reasoning. How can you blame Dr. Tufton for what happened at the hospital? Come on. I don't understand. No, as I said, let me calm down because that is just ridiculous. Listen, I'm not saying that he's my favorite person, but that's not the point. Hello. Right is right. Okay? No, as one of your callers mentioned, micromanaging. But listen, we blame, you know, I think part of the problem in Jamaica. I'm not saying that they're perfect, neither parties, but why do we have to blame the government for every striking thing? What about you as a person? As a human, what? No, let me tell you, President Kennedy, I love this. President Kennedy had said at one point, ask not what your country can do for you, ask what you can do for your country. My people of Jamaica, think about that. What can you do for Jamaica? I'm not saying that things are, listen, I went back there years ago. I moved back, okay? And I'm going to tell you something. Anyway, I'm glad I did because I got to experience Jamaica as an adult, right? But let's get back to these people. Critical thinking. The board of directors or whomever the managers are at Bustamante Children's Hospital, since we want to point fingers, they should be held accountable. The doctor called them 2 months ago about this surgery. 2 months ago. I would think that we'd have everything in order, right? But anyway, Jeffrey, let me go because Jeffrey, my people, wake up. Wake up, my darling people. Come on. Use the light up, oh God, and whatever. Use the brain that the divine gave you, but also practice some critical thinking and critical reasoning.
Yes, ma'am.
Why should Mr. Tufton be blamed for the mismanagement as far as I'm concerned? And no offense, that's true. Someone I think you did. Why couldn't somebody at Bustamante Children's Hospital pick up the phone from even a week ago and call UWI or public or and say, listen, we have a volunteer coming in to do a critical surgery. Unfortunately, our operating room is not at the standard that's required for the surgery. Could you help us out? So my point is this: with finger points, there are many different people that we can point the fingers at.
Indeed.
Because come on, somebody could have picked up the phone and asked one of the other hospitals,
I'll tell you something,
including
a lot of people
Yes,
believe
sir.
that. Hold on there. A lot of people believe that Tufton must pick up the phone and call, which is that he did, and call the other hospital and say, okay, this now works. So Tufton was in Bustamante Hospital doing a surgery. But their condition now work. Tufton no say their condition now work from when I never do a damn thing. Tufton no say
Jeffrey,
hold on.
you sorry.
Hello, are you hearing me?
Yes, no, what it is, I guess, you know, WhatsApp this time of
Yes.
the day.
No,
Go
I'm
on, sir,
saying to
go on.
you that Tufton no say the grounds at the Sablama Hospital no cut in 3 days. Tufton no say there's a pipe top at the surgical room not working and Tufton no fix it. Tufton no say the electrical system at the Sablama Hospital now work properly and you no fix it. Tufton know everything and they do not about it. Because nobody else now work at the hospital but Tufton.
This is ridiculous. Why do we have managers? Okay, no, listen, I worked in Jamaica and so I understand somewhat this is. We have all these managers who sit in them office. I wasn't one of them. Listen, I worked. All right, then listen, folks, you're being paid a decent salary. Stop grabbing and come and do your job. Oh, that's all I have to say. Jeffrey, anyway, I'll talk back to you another time about what was going on in Negril yesterday. I hear you.
Yes, ma'am.
And then I heard this morning that someone tried.
Yes, somebody called me yesterday.
No.
After the
But
program.
do they listen to you? Do they listen to you?
Somebody called me for the program yesterday and said to me, say, they can pay me certain amount of money if you shut up my mouth about the hotel.
Well, it's apparent the person who called you was not intelligent, because if she listened to you a few times your program, she don't no, he's not no. What's the word that we use in Jamaica? Wishy-washy or whatever. No, you are not. You speak your truth and what your beliefs are. Okay, so that was that was an ignorant person to be calling in offering you funds. If they listen to your program, they should know that will not work.
All right, ma'am. Thanks for calling in.
Jeffrey, you take it and listen. You continue on, because Jamaica, we need someone like you. Okay. Anyway, thank you, my darling.
Bye-bye.
Ciao. Ridiculous.
A lot of people don't want, they want me to come and, okay. Good afternoon, welcome to the Mek Wi Talk. What this? I want to hang up the phone for. Good afternoon. The numbers are 9545298803. Good afternoon, oh Lord. A lot of people don't believe in certain things, you know. And we believe in other things. And your opinion is your opinion. But I'm going to spit the truth. I've worked in a hospital before, and I know how other things work. The CEOs will sit down, especially in Jamaica, and sit down and do a damn thing. If you finally get their money, they're not busy with nothing. Good afternoon, welcome to the Mek Wi Talk program. You're live.
Hail the eye.
Hail the eye, Selassie eye, Jarastafari.
Morning at the road.
What go on, my brother?
Ask you a question.
Yeah, man. Go ahead, man.
You can put on stick butter on fireside, sir.
Hold on there. And when we are running both at and Negril, what's wrong with you?
All right, before me go into that, Jeffrey, you notice when there's an issue, instead of the leader spend time to fix the issue, they spend time and money fixing up how it looks. They go to Mr. Refuse and Mr. Refuse and him can go and him whole staff to fix how it look instead of fix the issue. Wouldn't the time be better spent fixing the issue than how the issue looks?
Simple, because Because if the CEO of the hospital will fix the damage, there won't be a problem this morning.
All right. We put it on with
Hello?
we put it on butterfly side, sir.
Uh-huh.
Me now hear like say Mr. 300% will leave and it Lime Bush say Mr. 28 don't take over that the portfolio there.
Oh, got it.
You hear any word like that, sir?
I'm hearing something, sir, but I can't repeat it because I can't confirm it. I mean, I put no fake news from my channel.
A Lime Bush, me say, sir.
Me know, man. Me understand what you say.
Okay, no matter how you see me go on, from the first day I call you, Mr. Jeffrey, I told you, you don't have to be in fear because I have more sense than to get you and your program in trouble. Yeah. Yes. But that would have look like we go and put stick butter on fire side.
Stick butter, sir.
Well, I don't think that would be a good idea to put stick butter on fire side. It will melt, you know, sir.
It will melt out everything, sir.
Yes, sir. You only have the paper leaf.
Let me ask you a question.
Mm-hmm.
Do you believe that Jamaica's health problem just happened like that?
No, it couldn't be. Couldn't be.
Do you believe?
But
hold on for me. Do you believe that the running down of the hospitals and health centers in our country just happened in 8 years?
No, sir. Certainly not. But you're not running away from 2 billion turning to 22, though. I think that money could fix a lot of issues. Oh, okay. So
nonsense.
So, Mr. Jeffrey, spending the most money. I tell you something. If a person who know how to get something done, and a person who want to get something done, the person who know how to get it done can spend hundreds of millions and don't get it done. And the person who don't know how to get it done but want to get it done can spend 2 million and get it done in no, sir. So spending the most money on something doesn't get the thing done, sir. Getting the thing done is getting it done. So if you keep on beating the pitney and the pitney don't have the money in their pocket, you can't take it out there, you know.
True.
You have to go find the pocket where it in and take it out of.
So true.
So each time there is an issue. You remember what that Cherry Tree Lane, or you remember I call you and tell you how you going to fix it, you know. You see that fix. Yeah, that fix already. Yeah. That fix. Yeah.
Just a band-aid.
And I told you the emotions was running high and me nervous when me see you nearly go agree with them for poor people fitness. And the culprit them.
You mean with the hanging you're talking about?
Oh, no. Yeah, when you remember the emotion was high and even a respectable preacher man went down there and said, put aside his religious belief.
And resume hanging.
Okay. All right. So these people, they spend more time on how things look than what it is. How things look cannot run a country. Because the reality is still there.
True.
So let me ask you the next thing.
Mm-hmm.
When Mr. 300%, you say, Mr. Jeffrey, did go the 300% route.
Uh-huh.
Didn't they say the reason why they was able to do it was because the country was in good standing and afford it?
Yes, and now the country have to be pumping millions of dollars to save the dollar.
Okay, so that means it wasn't true then. So it wasn't true then.
I don't know. You know.
Mr. Jeffrey. No, but if they said that it was in good standing, that's why they was able to do it, and they went ahead and do it. And no,
from an accounting
it
point
seems otherwise.
From an accounting point of view, and listen to what economist Ralston is saying, the country is not in a good place at all, you know.
Okay, all right. So then, that means once upon a time, if you take money under false pretense, that would be called fraud, right?
Yes.
So that means they should return that money, and if not, what Marcus Garvey say about the square?
Somebody had no road down the street.
In the philosophies of Marcus, those leaders should be taken into a square and do something.
Beat them behind.
Marcus Garvey said they should be hung, and you make a statue out of them.
Indeed.
Okay, sir. All right, Master Free, you have a good day, because me I go do a little hustling now, because I have to reach up a diamond house later.
Here I know. Lord have mercy, dear God.
You have a good day.
All right, my brother. We'll talk.
Good.
Good. Whenever he calls you, there's always something to make you laugh. Anyway, we're going to come to the end of the program for another day. And okay, another call coming in. Good afternoon, caller. Welcome to the program. You're live.
Good afternoon, sweetie pie. How are you?
How are you doing, my sister? You good?
Yes. Good. May I listen?
Yes.
May I listen? May I listen? I wait. Boy, I mean, I know, my brother. I mean, I know. No, so I still a pray do.
That's all we have.
Because I want to pray. Yeah, man, I want to pray. I can't help, man. Nothing else can work.
That's all we have to do.
Nothing else won't do. We just have a prayer. You see, when time God wake we up in a one serious kind of way, and that's how we are going to take and say, we really need to see where we are come from and where we are going. Jamaica last this way.
Big time.
Jamaica last this way. Jamaica not depend no direction right now. Jamaica don't know where to go. Jamaica don't know where to come from. So if you don't know where you come from, how you gonna know where you go? Because Jamaica lost its way. Jamaica lost its way. How we get here, I don't know, about Jamaica lost its way.
You know something? So, I want you to listen to something from my sister before you go. I want to say something.
Yes. Here. Yes.
What I know so far about money being donated to certain places.
Yeah.
If money is donated to the Sablamar Hospital,
yeah,
there is an account at the Sablamar. There's an account that the Sablamar Hospital have to deal with, have to work with, at either bank in Sablamar or wherever.
Yeah.
And when the check is being drawn, the only person who can sign that check is the CEO for the hospital, or the board of directors for the hospital. As far as I know, no minister, whether the PNP is in power, the JLP is in power, don't sign any check when it comes onto a hospital.
So who signed the check?
Huh?
Who signed the check?
The check is signed by the CEO of a hospital, not the minister.
That's the way it's supposed to be. But right now, who's signing the checks?
The check is signed by the CEO of a hospital, not the minister. Whenever money is going down to the hospitals, the permanent secretary sign the check, not the minister.
No. So
hold on for me, darling. If I am wrong, I'm stand to be corrected. Neither Minister Tufton, who was the Minister of Health, or Minister Morris Guy, who was the Minister of Health under the PNP, do not sign any check in the Ministry of Health.
No.
It's the permanent secretaries that do so.
So is there any check going to the hospitals?
Yes, there's check going to the hospital.
So why the hospital them not have no bed?
It's a different kettle of fish.
And why the hospital them not have no good doctors, paid practitioner?
The doctors are leaving in medical institution, ma'am.
So all the Jamaican people them are gonna make it out.
Ask them because they sit down there. And all they can't think about is PNP and jail fee. They can't think about the country.
So that's why America no good neither to, you know, because we live here, but it no good neither to, but it better than everywhere else.
Aye.
So whatever hospital we get take care of, whether we have insurance or no insurance, them take care of we and bill we later. Because if they don't, then they know that they are going to get a lawsuit somewhere around the corner. Because if me come to hospital and sick and you don't take care of me and anything happen to me, and if me dead, my family can sue you and then become a millionaire, multi-millionaire. Jamaica, you go to hospital and dead on the cardboard and nobody can sue nobody.
They can't sue, but the Jamaican people have the money for sue.
No, but just so we not have no money for sue.
But in Jamaica, you have the money for sue because they lie them. They lie them down. Some of the lie them then this as bad as the government, you know.
Them worse than the government.
Aye.
You know, you with the name liars. Liars. You with the name liars. How are we going to get out of this? This is my problem, you know. This me no worry about nothing, you know. Me just sit down and I look. And I ask myself, how are we going to get out of the situation that we find ourselves in as a Jamaican country?
If the people of our country, ma'am, do not sit down and come together and formulate a plan to get ourselves out of this and be independent and not be die-hearted down to them very puss and dagger than yard and labor right or PNP, this country not going to come better, you know.
But right now, me not see nobody at Jamaica look at them plan to get up.
No,
everybody look like them up there dead.
Because listen to me.
So when them will get up?
Listen to me.
When
what is going on, you know? They're saying that it's only we who see the problem. Them not see no problem down there.
So if them not see no problem, we're not supposed to see no problem neither then.
There you go.
Because we there foreign and we are live life and we are work and I try to say if we can make two ends meet. But if you there Jamaica, me not live no life, but me I make two ends meet. But if you there Jamaica and you see say you suffer, you not have hospital, you not have school, you not have good police station, you not have soldier, you not have nothing.
Them don't see that, you know, because if Andrew Horner should call election tomorrow morning, you're surprised to see the amount of people who have truck to get in and no water.
Yeah, but at the end of the day, they on the truck, when you come off of the truck, Andrew want to give something out and 28 bank accounts to go buy some food for your children.
Them not thinking about that, caller.
Oh, them not thinking about that.
No.
Oh. So we stay foreign and think about it, and then when they're hungry, then we have to send some money to Western Union. No, well, me not work like that, you know, me used to do it like that, but I realize, say, Jamaican people don't understand, say, the world is coming to an end. And everywhere in the world is hard. America hard, you know, because them can get a banana across the street. We don't get nothing here, so the banana, then when we get them full of fertilizer till them fat, like, then look like body. Or them big banana.
Me hear what I heard a Labour Party propagandist saying that all of we who run around the Michael Manday, according to her, we live in a trailer home. A container home.
Okay.
And Jamaica is much better than where we live. Nothing wrong with Jamaica.
What?
There's no problem
Oh,
in
yeah,
Jamaica.
so something wrong with trailer home America.
You look
At least you live somewhere. You live somewhere. And if a day I saw you feel like say you have 2, 3 children and you can't get no help and you work and enough, you can go to the food stamp place and then get the food stamp. And the food stamp go to the supermarket. Not saying that you need to go get food stamp if you can work and figure out the thing, but Jamaica not have no help for the poor. America have help for the poor. America have help for the poor. America look out for them citizens. They might not do it the way you want them to do it, but them look out for them citizens.
Not Jamaica, because you believe if a Spanish hotel is in the United States and they're paying the American citizens below the
minimum wage.
The minimum wage.
Minimum wage.
You believe that the Minister of Labor, the Secretary of Labor, current Secretary of Labor up here, would not go meet with only the managers alone and meet with the staff members?
No, them not meet with the manager. They're going to be on the field with everybody. Oh, you ever see when time we strike up here in a union and who you see them go talk to? You see them go talk to no CEO and no COE or whatever they want to talk to. Then talk to the workers on the field because they are the one who going through the stuff.
And some people believe that there was a pain power. The minister would not go speak with the people them. Not a damn thing. The minister will go speak to the CEO them same way.
No, go to America. That's how we do it here. We don't do that. We don't do that something there. We don't do that something there. America is not a perfect country. It's not a good country. It's Babylon country. But at the end of the day, they do what they have to do for the citizen. Yes, we have problem here. Yes, we have homeless here. Yes, we have hungry here. Yes, we have everything here. But it's a big country. Jamaica not big like Brooklyn and Jamaica can take care of itself. Seriously. Jamaica not big like Brooklyn. And that's one borough of New York. And a 5 borough we have. And you can't take care of your citizens them. Jamaica, so how that gonna go? The Prime Minister no care. The Deputy Prime Minister no care. The MP them no care. The councillor no care. And the people them look like so them just lay down and how will them do to them? Then obey them.
Well, based on what Mr. they go on, when you're ready to see the PM and Babs, they go dance table. No, Mr. the PM, they walk up and down with a certain man from Mandeville. I can't know.
My pastor preach both in morning, noon, and night, but the whole of them are going to go down, you know, it's only a matter of time. Because it's not the beginning of the earth, you know, it's the end of it. Them are going to go down fast and quick because the Bible said, be careful what you do, because whatever you do, it's going to come back to haunt you. And the world is a cycle, it's going around. It's not, you know, flat, it's going around. This is not a man. Let me tell you something, my brother. You see, Jamaica reach a stage in a life where it's not a man problem anymore. It's a God problem. And you know, say God, I got to do some dangerous thing in Jamaica. You see, rain can't tap fall. You know why I'm fall the rain? It must saturate the earth. It must saturate, it must saturate the earth. Yeah, you must saturate the earth. So you see when them saturate the earth now, you see the next earthquake come. One if a piece can broke off in here. Remember Port Royal, me never there here. But me read it in a book. It's gonna be like Port Royal. We are gonna look and people are gonna look and see and say, how Jamaica did they? You know, I say, you know, say that piece that they do over this and that piece that they do over this and that piece that they do over this. Cause it's gonna broke up in it gonna broke up in God vexed, you know. God is so upset. And Jamaican people now wake up and say God upset. There's so much rain fall. There's so much place under flood. There's so much place I run like river road, turn river road. I wash a car and people car wash off a sidewalk. You think that God just send rain because he wants send rain? He must saturate the earth. So you see when him shake it. Hey!
Saturate. Mean your anointing, Lord.
I'm if it tell you, it's when you saturate the earth. Because Jamaica not supposed to under so much water in it because it's in a water. And what we fail to understand is we are in the middle of the sea. land of wood and water. Then the water no did it. Water not running a pipe.
So hood.
No water. So we have a whole heap of hood, but no water. So you see when time them the water they saturate the wood and the wood dry heaven. Dry soap. So the water, so them don't saturate it and the wood then get heavy, it just go down. Yes, and that's going on Jamaica right now. Lord Jesus Christ help us.
All right, Mrs. Mary Talk, I gotta go.
Now watch your face, take care of yourself, we are pray. Just pray here, because that's where we come from, because when time America start showing out, we don't know where to go, you realize that we don't know where to go.
True.
When America say, hold on, go back where we come from. Where are we going to go?
When, because if they continue selling the country brick by brick, Khalistan by Khalistan and everything like that, we're doing it block by block. We don't know if we go back.
No, we just we were there, we have one of people in America, about 3 million with the America. When we go down, when America say it's time for we to go, we just have to go down with the intention. So you see, when you come from here, you have to start take on yourself, and we just speak out, then watch it, not send them back where they come from.
I talk already, you know. I said on a program before. I said they're gonna come that time. You see all the hotel in the middle of Jamaica? Jamaicans are gonna go.
Beat them and send them back where they come from, and all of the poor people them who live in Jamaica go live in them fancy hotel, everybody grab a room.
Mark my word.
Everybody grab a room. You hear what I said to you? That's the time that we're going into right this very minute. All them fancy hotel and them fancy railway and them fancy this from wherever they come from. If there's a time when come where we're going to go down there and beat all the whole of them, what's it not, and say, find back your destination, and everybody grab a room and there would be no homeless in Jamaica. Yes. You take care of yourself. I'm willing to fight the war, I'm willing to go down and go beat out them, what's it not, but then come out of my country and go back to your yard.
All right, my darling.
You love you, my brother. Take care of yourself.
All right, cool. As we're going to come to the end of another program for today, I want to say thank you all for calling in. Thanks for our callers. Thanks for those who play a part in this program. Thank you all very much for coming on. Remember to like, share, and subscribe, and hit the super chat. If you care to donate anything to the program, you have the number. It's running across the screen there. Remember to like, share, and subscribe to the Mek Wi Talk Jeffrey Tavares YouTube channel. Until you hear our voice again, may God bless you. And may God bless our island home, Jamaica land we love. Remember, Jamaicans, remember that this election depends on you, the Jamaican people. The soul of Jamaica's democracy is in the palm of your hands. Do not sit down and don't vote. The soul of Jamaica's democracy, Jamaicans, relies on you, the Jamaican people. When the election is called, Jamaicans go out and vote. Vote for a better Jamaica. I will never tell you who to vote for or who not to vote for, but go out and vote. God bless you. May God bless this island home of ours, Jamaica land we love. Remember to like, share, and subscribe. Have a great afternoon, everyone.
When the game gets rough and this life just seems so tough, Mek Wi Talk, my people, Mek Wi Talk. When this town becomes an ugly place, don't let it erase the smile from your face. Mek Wi Talk, people, Mek Wi Talk. Conversation is the key, a guiding light for you and me. Spark a talk and you will see. Conflict solver A to Z. World leaders master the art of self-defense just by talk. So people, Mek Wi Talk. Hey, we're living in a world that on ourselves we must depend. Mek Wi Talk.